for my next trick. So I recently got asked to do a video on binders, chest binders, specifically for those of the transmasculine persuasion. Anyway, so there is a lot to discuss with binders, and it could probably be, God, anywhere from 30 to 60 minutes worth of a talk. I'm going to try and get it in under 10 minutes. We'll see. I'm just going to hit the high points for folks out there who are unfamiliar or whatnot. I mean, there's always places you can seek more information. But anyways, and you can always write into me, whatever. Anywho, so to start off, and sorry, I had to make a list because there literally is so much stuff to talk about. So if you see me glancing around, I'm probably trying to see my poor little notes. Hamster brain. Anyways, so number one is how to actually place the chest binder on the chest tissue. People get confused, or they think they're going to cover stuff up a little bit easier and everything, and it can actually end up harming the tissue underneath if you do so. And I know you might be like, who cares if I hurt those things, but it can affect you in the future and everything, so let's just do it right. So whenever you get your binder, it is important, I'm sure you've heard it before, don't get a binder that's like a size or two too small. A lot of people do this because they figure it's going to mash down the tissue a little bit better and will hide it just a little bit more. This can actually end up hurting you in the long run, and we'll discuss that more toward the second half of the video. Anywho, whenever you get your binder and you're putting it on, the way you should place the actual chest tissue is to get the chest tissue up in your hands and press it inwards towards your chest, as if you're making basically two pancakes. The nipples would be central to those pancakes, and you press them in, and that tissue will spread out. So you arrange under the binder like that, so that the chest tissue is smushed flat and evenly into two rounded pancake type shapes. It's the best example I could come up with. The reason you don't want to, number one, push up the chest tissue under the binder is because that would kind of work against you. It actually would end up poking out the binder toward the top and kind of defeating the purpose. And the reason you don't want to push the chest tissue down, because I see some people do that, and I guess it's just because they figure it'll get it away from their face and it'll get it more toward their belly or something like that. You don't want to do that because you can actually create micro tears and things like that to the tissue underneath. And over time, if you're wearing it inappropriately like that, it can actually affect the way that the skin tissue heals. So if in the future you ever do decide to have any kind of surgery, it could impair how you heal, and it could create worse scarring. So that's something to be aware of, sure. But like I said, when you put it on, just mush the chest tissue up against you, making two flat, you hope anyway, pancakes on there, nipples front and center, and just mush that way, okay? Next, you're going to want to make sure you can take a good deep breath with that chest binder on. If you can't breathe in all the way, like, you are not wearing the right size. You are wearing one that is too small, and you're going to hurt yourself. I know it seems like, oh, I'll pay attention and everything. No. Too many people have had bad things happen to them because of wearing an inappropriately sized binder because of their dysphoria or what have you, wanting to cover these things up. Don't do that. It's not worth it. Anywho, so that's how to actually place it. Now, choosing a binder can be very difficult. There's all kinds of different shapes and sizes. They make them in almost like a sports bra type size. They make them in like a tank top. They have all kinds. And I wish there were stores everywhere where you could go and try them on, but what are you going to do? You just kind of have to take stock of your body shape, size, and everything, because everybody's going to have a different fat content, like, myself. Nah, anyway. So, everyone's going to have a different fat content. Everyone's going to have a different shape to their rib cage. So these are things you need to kind of take into consideration. If you have a rather large stomach or abdomen, you might not want to opt for the kind that pulls down over the belly too, because that's going to compress even more tissue internally and make it more difficult to breathe, and can actually have like issues on your GI system and things as well if you do that. So you might want to stick to the one that stays more up top if you're going to be looking for one. If you have a rather large-ish abdomen, if you're kind of middle size, you could probably go either way. And of course, if you're a beanpole, you can probably use either or. Anyways, so get a size that's going to work for your body, and again, that you can take a good deep breath in. You're going to want to choose a fabric that's breathable. You don't want to get something that's made out of something semi-plastic or whatever that's going to keep moisture in, because that can cause all kind of skin breakdown and issues with rashes and itching and things. So, breathable fabric. Then when you're wearing it, try to keep cool. You know, that's just kind of general advice. I'm saying that because of the whole fabric thing and the thought of sweating and whatnot. Some people have said, you know, they feel hot all the time whenever they're wearing binders, and it actually is a real thing that people can overheat. So you want to stay hydrated and stay cool while you're wearing your binder. How long to wear binders? So the standard answer, even though there is not a lot of research on this, I will admit that, there have been some studies. A lot of them were just like anecdotal information or just people's opinions and things that, you know, they think happened or whatever. But the standard is 8 hours, no longer than 8 hours wearing the binder. It doesn't matter how well you think you're able to breathe and everything. You really need to get out of that thing after 8 hours, and do not sleep in it. Oh, good Lord, do not sleep in that thing. One, you're going to wear your binder out before it's time. You know, it's going to get old before it's time, the poor thing. And these things are not cheap. So take care of it. Don't wear it when you sleep. One, it'll hurt you. And two, it'll hurt the poor binder. Don't do it. Anyways, if you can, out of the week, out of 7 days, take 1 day without wearing it. You know, find a day when either nobody's going to be around or you don't have to go anywhere. Don't wear it at all. This really is important. I can't, you know, say it enough. Just take time to be out of it. Don't wear it more than 8 hours, and don't sleep in it for sure. And then 1 out of every 7 days, find a way to just not wear it at all. I know sometimes it can be very difficult for some folks, but for safety's sake, it really is important. And now, so let's get over to what can happen if you're wearing these inappropriately or too long. And sometimes even if you're doing well, things can happen too. So listen to your body. If something's not right, analyze yourself. Don't let things get out of control before you seek help. So there are skin issues that can happen with wearing binders, and back to the whole, you know, what kind of material it's made out of, that can be a factor. Also, you know, cleaning the binder in between use and keeping down moisture and heat and stuff can be a factor, because wearing these things can cause acne in the area that it's being worn on. It can cause bacterial and fungal skin infections, scarring. It can actually cause scarring where it rubs consistently over time. Can have tissue swelling, just tenderness to the area. So a lot of skin and tissue issues that you can have just from over wearing it or getting it wet or not cleaning it, you know, often enough or something like that. Anyway, so another thing that can happen is, I mean, of course, the chest area has a lot of nerves in it, especially the front top part of the chest area. And whenever you compress these nerves, you can get irritation there, and it can light a fire in your chest. I mean, it can be pain that can happen in the front or all the way around the back. All these things are connected. So if you start feeling like you're having chest pain, back pain, you know, shoulder pain, that doesn't make a lot of sense, you might want to take a break from that binder. It might be doing some stuff there. Respiratory issues are going to be the main thing we focus on, really, whenever we're talking about dangers of binders, because, you know, let's face it, the skin issues, they're annoying and everything, but okay, you know, you're not usually going to die from them. Breathing, you can die from not breathing appropriately. So here's the thing. One, if your binder's too tight, of course, you can't take a deep breath and everything. The bottoms of your lungs are not supposed to stick together, but they will kind of collapse in on each other if you're not taking very deep breaths. And this is very common in the post-operative patients that I've taken care of in the hospital. After surgery, they're laying around in bed, they're not up and moving like they usually are, so they're not getting good deep breaths like they normally would. And this is why post-operative patients can commonly encounter pneumonia. And that's because those secretions in your lungs like to settle down at the bottom and grow stuff. The same thing can happen with binders if you're not careful. So watch out. Pneumonia is a serious complication that can happen from wearing a binder. Also, people have had rib fractures from wearing them, either from wearing them too tight, or they're wearing them and they're pretty tight, but then they go to, you know, do a sudden movement, bend down, or you know, try to play sports in one or something and they've cracked ribs. Not fun. Anyway, if you have an underlying condition such as asthma or COPD or some other kind of problem that is central to breathing, be extra careful wearing binders and make sure you are sizing it out right, because that can create oodles of trouble for you. And if you are sick, do not wear a binder, especially if you have something like pneumonia or if you have an asthma exacerbation, you're having an asthma attack. Do not wear a binder. It will make things worse, 100% guaranteed. So be very careful with that. If you're sick, take it off. Let everything breathe, take it off. Let's see. So next topic off of respiratory issues would be musculoskeletal issues. So wearing these things for too long has actually been shown to decrease muscle mass and tone in the chest wall area, because the body is very adaptive, and whenever you have something that you're wearing that's causing it to be supported by this artificial device, these core muscles and such, for so long, the body adapts and it will not put much effort into maintaining the tissue and muscle around this area. So you can actually have some atrophy there. Who wants that? That's trash. You can also have posture changes. So, you know, depending on how the binder fits, it could make you sit too straight. It could make you hunch over. Just depends on the fit. So be careful about that as well. If you wear it too long, it can actually cause permanent posture changes. And then there was the whole rib fracture thing. Like I said, if you're trying to be active in these binders, be very, very careful, because if the one you have is very rigid, it can actually end up hurting you if you're doing sudden motions. And then there have been some cases where folks are wearing them so tight that it pulls their shoulders into a certain position, makes it kind of difficult to maneuver, and you can actually end up popping your shoulders a lot, which over time will grind down what you have there in your joints. So another just kind of crappy thing that can happen over time if you're wearing things a little too tight or inappropriately or whatnot. Some kind of neuro issues that you can have, and these kind of relate back more to other things. So you can have like dizziness, headaches, lightheadedness, some numbness, but that really goes back to either, like, the numbness would be the nerves getting compressed on the chest. The dizziness, headaches, and stuff like that is going to be more related to the lack of oxygen, because if you're walking around and you're not being able to get very good deep breaths, you're probably going to notice it by feeling weaker or fatiguing, you know, getting tired sooner. It can cause headaches as well. And you might even feel a little bit dizzy here and there if you pick up the pace and, you know, start walking fast or something somewhere, and then all of a sudden you're like, whew, okay, I feel winded. You know, if you're feeling short of breath in your binder, stop wearing it right then. Just stop it. You know, you're going to have bad things happen. Stop. Anywho, other just kind of things to throw out there that could happen are, of course, the overheating thing. Like I said, if you're putting a cover on the core of your body, which is basically the source of your body heat, what do you think is going to happen? So you've got this thing compressing everything inwards on top of the thing that produces the heat in your body, and and then you go out about your day and, you know, you're active, or let's say you're here in Mississippi or whatever, and you're going out in the sun. I mean, drink water, check yourself, make sure you're not getting too hot there, or else you might find yourself on the ground. And then also, this can cause, I think I briefly mentioned before, some digestive issues. So if you're wearing the kind that goes down all the way, or if you're wearing a top one that's too tight so that it compresses across the middle where it's like just under your ribs, it can kind of push in on your intestines and stuff, and it can cause, you know, anything from mild stuff like just gas and bloating to full-on just major constipation and stuff like that. I mean, who wants to deal with that kind of stuff, honestly? But anyway, so this has been kind of an overview. I did not manage to keep it as short as I wanted to. We're almost at 15 minutes at this point, but whatever. I got some good information out there. If you have any questions, like I said, just write to me. It's no problem at all. There's plenty of other topics to talk about with binders, but I didn't want to make this video so dang long. Anyway, y'all have a nice day. See you later.